Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. Earlier this year, we introduced you to Eric Moore and his wife, Heather. Eric desperately needed a stem cell transplant after chemo failed to put his lymphoma in remission. And maybe you can call it fate or maybe just a call of luck, but a perfectly matched donor was someone that he hadn't seen in 27 years, and he walked back into his life just in the nick of time. Today, we are checking back in with Eric to learn more about what life has been like after surviving cancer. Eric, good morning. How are you?
Oh, I'm beautiful, ma'am.
You look great. You sound great. We're so glad to see you doing well. We have some of your care team here with us. So we're going to talk to them in just a bit. But before we meet them and reconnect you, we want to go back and explain how Eric reconnected with his stem cell donor. Eric Moore and his wife Heather have been through a lot.
I almost lost him years ago in an oil rig accident, and then he was in a bike wreck in 2020 and had a skull fracture.
Eric had cheated death before, and in 2022 was about to do it again.
His stomach just kind of started swelling.
A CT scan revealed Eric had lymphoma. He immediately started chemotherapy. Soon, Eric thought he had it beat, but within a matter of weeks, the cancer was back. He was sent to the University of Kansas Cancer Center into the care of Dr. Nashin Ahmed.
It was just wreaking havoc on all kinds of my bodily systems because once it got into my spine and my spinal fluid, it had the opportunity just to wreak havoc everywhere.
This time, doctors told him he would need a stem cell transplant.
Dr. Ahmed said, you know, your best bet is to have a 100% match, and we're running out of time.
Eric went into search mode for that 1 in a million donor match that would save his life. But who?
It's almost like God was preparing us for this. He was putting all the lifeboats that we were going to need in place.
And that lifeboat came in the way of a random Facebook message Heather received just a month earlier.
And I get a message and it says, "My name is Jennifer. I'm trying to find my brother."
After not speaking for 20 years, Jennifer wanted to reconnect with her brother Eric, and so did another brother, Jesse.
It was really amazing just to get that initial, okay, so he's alive, he's, still around and everything.
It was a lot for Eric and his family to digest, but Heather had a thought.
And then with talking with his wife, Heather, had to learn, okay, he's battling cancer. And then it was, hey, do you guys want to try this to see if you're a match on the stem cells? It was a couple-week process between finding him, making that contact, and then the initial ask of, hey, are you interested in giving this a shot?
And within 2 weeks of reconnecting, Jesse was on his way to Kansas City to donate his stem cells to big brother Eric without hesitation.
Not at all. It was only that much more because it was my brother, but I mean, if I had a chance to help somebody have a better life, I'd choose the same thing.
It's someone throwing you a lifeline that doesn't have to. I'm grateful.
Now in complete remission, Eric is hopeful cancer is behind him. As for his newly found family, that story to be continued. And this is what we call the power, the positive power of social media. Eric, it's been 8 months since we talked with you here on our program. How are you doing today?
Really, really good. I just went through my 1 year checkups from post-transplant. So I went through the PET scan, the bone marrow biopsy, the lumbar puncture, and everything is still cancer-free, 100%.
That has just got to be so thrilling for you and Heather and your entire family. What's it been like for you all emotionally?
It's been humbling, because you go from a position of, not to sound too cavemanish, but, hunter provider to, there was a lot of this last year that I needed help with just daily life, just being able to function. And it's a blessing, that I had my care team, my wife, my family, because we've seen some people when we were going through this process that their family life didn't hold up through that, and marriages split and people broke relations, and it was too much to deal with, for somebody else's feelings or something. So I feel very blessed that the people and the care team and doctors and everything that have been placed in my life are there.
And we're going to meet two of them here in just a moment, but we talk about the blessing of good health, but also the blessing of this new family, newfound, reconnected family. Nothing better. It's such a great part of your story. We saw a picture that you shared with us from last Easter. It was one of the first big holidays you had with your siblings after all those years. What are you looking forward to as we've just got through Thanksgiving and now we've got Christmas and the New Year coming?
Actually, we're planning on coming back up here for some doctor and eye appointments on the 27th of December. And then on the way back home, stopping by Jennifer's house for a couple of days and staying and being able to actually have a holiday festival with the family that is immediate in the area.
Yeah, Jennifer, that's your sister that reached out and helped connect you with your brother. I want to bring in two blood and marrow transplant coordinators, Shalene King and Ellen Klostermeyer. Shalene is the pre-transplant coordinator and Ellen is a post-transplant coordinator, and they're going to kind of help teach us why those specialized roles are so important and what they do for patients and caregivers. And Ellen, once someone survives cancer, how hard is it to get back to normal life, or I guess start to get forward with their new normal life?
I don't know if that's something you can answer with like a number. It's so hard. We put these patients through a whole heck of a lot. They are challenged every day. They come and see us 2 to 3 times a week for 100 days. And so I would say like maybe at that year mark, people finally start to feel like, okay, things are getting back to normal, but I don't know that they'll ever feel completely normal.
Right. It's a new normal, but as Erica said, it's like a new normal full of just gratitude and blessings.
100%.
It's just, you look at life, it's so different. And I was going to ask you what follow-up care was like, but Eric's kind of explained it. It's a lot of, checking back in, doing these year scans, and it's just kind of part of the new life, right?
Yeah. And we're happy to be a part of it for that long. We're blessed to be able to see our patients and frequently and see how well they're doing. It's such a positive thing.
And Ellen, Shalene, you both were looking at Eric and you're like, he looks so good. What's it like for you, Shalene, just to see him doing so well and just looking physically so different than you've seen him over the past year?
It's truly amazing. It really kind of brings full circle to the work that we do, seeing them when they're at their worst, helping them secure their caregiving team, their medical evaluation, going through all the hoops just to get to transplant and feeling so poorly, and then to see him a year out, it's amazing. It's very rewarding.
Ellen?
Yeah, couldn't agree more. Like, Eric, you look amazing. You really do. You look great. So different from the first time I met you in such a positive way. But yeah, it's amazing to be able to see these patients thrive after, we've seen them at some of their worst.
Yeah. And we talk so much about the physical aspect of it, but the mental health aspect really it's almost like it's just a lifelong thing. We all manage that so differently. What has, as far as mental health goes, Eric, how have you managed that to take care of that aspect of it? Just staying up and staying positive and just kind of take us inside that world.
Well, and that's I think is a big part of it is, okay, so this is going to sound really weird, but for it being cancer, I got so many positive things in my life. I got my family connections renewed. My faith was strengthened. My relationship with my wife is so much stronger. Like I said, my faith, my belief has increased so much that, it's cancer, but I almost look at it with a positive aspect. And you could be, oh man, I missed this last year. Oh man, I had to let my car go back because I wasn't making payments, or, and there's things that you can look at and be negative about, but I can't. I'm alive. I'm doing better than I was when I got the cancer, and everything in my life is looking so much more positive if I just don't get in that self-pity stuck mode. I feel better off for having the cancer than I was before the cancer, honestly.
Yeah, funny. It's a funny thing how it works that way. No one would ever want that. No one ever wants to hear that word. But to take it on and you said it may sound weird, and I'm like, we love weird. Nothing about any of that sounds weird. Stronger faith, stronger relationships. That hits to the heart of it, and I appreciate you sharing all of that. Let's talk about Heather, your wife. She's kind of amazing. So let's talk about her. She couldn't join us this morning, but we saw her in that piece. So let's let you brag about her a bit as your caregiver and your wife.
Yeah. Next to my God, I couldn't ask for a better. Every appointment, every medicine, every doctor visit, every time I had to wake up in the morning and chew this pill and take this pill with milk and eat this before I eat breakfast and take these pills after breakfast. She was just 100% on top of it. If it wasn't for her, there's three main things that got me through this: my faith, my doctors, and my caregiver. And without either one of those three, this wouldn't be possible. She was such a part. And I imagine that's probably true for almost anybody that's going through this scenario, that that caregiver really does make a difference. Because, there's times like when I first got sick and got up here to KU, I couldn't get out of bed to get into the wheelchair to get to the bathroom. I couldn't. I had a fever. I feel blessed to have her in my life.
Oh, I think you're getting okay. There you go. I think your phone may have been vibrating you out of the picture a little bit there. But while you're getting your shot set back up, you ladies, you know the Heathers of the world, the spouses, the partners who are there day by day. What kind of support are you offering them? Talk to us about that.
When we meet them for the first time, that's one of the first things we do. In addition to the medical evaluation for the patient, which is just a small part, we really have to get the caregivers aligned and engaged, and backup caregivers. We expect a lot from them. We put them through several hours of education along with the patient to really get them going. When it is definitely a barrier to transplant, not having a caregiver. So we have our, it's a collaborative team. We have our psychologists and our social workers, all of us working with them to really dig deep into who is in your life that you could make this ask of, that could come to the table and help you. And I always say to patients, if somebody asked you for help, would you do this? And hands down, they always say yes. And so it's just helping them look around their world and see who they can pull in to help.
Right, and you have to think caregivers are, they're going through this emotional state as well, and they've got jobs and other family members and children. I know Heather and Eric have 6 children. So what kind of challenges are they facing along the way? What advice do you give when they have their hard days, just like the patient?
Yeah, being a caregiver is just as hard as being a patient, I would say. And Heather was an amazing one. One of my favorites, to be certain. So she did such a great job asking questions, being there for Eric when he needed, being concerned when she needed to be, calling us when she was concerned about him. We never had to worry when Eric went home with Heather that there was going to be any issues, because she would give us a call. And happy that we could be there for her emotionally, but she did a lot of the heavy lifting, and she did a really, really wonderful job.
Well, it just dawned on me, it's like a peace of mind for you all, because you take care of him, and then you're like, I gotta pass the torch over to the caregiver. And you said we always knew that he'd be well taken care of, in good hands with her. So, but it starts with the teaching, some of those teaching skills, right?
It does, and with many patients, we work with the caregivers more than we do with the patient just getting started. So they're calling us. We're a resource to them as much as we expect them. They're an extension of the healthcare team, essentially, as patients go through the transplant. So,
and you explained as a pre-transplant coordinator, kind of some of those roles that you play at post-transplant. You're caring for Eric and seeing him in some of those really rough times. How long will you be following him?
Forever.
Forever,
Eric. Always. We'll always have our eyes on Eric. After transplant, we'll see these patients for 2 to 3 times a week for 100 days or so, and then we'll see them once a week for a few months after that, up until like the 6-month mark. And then as long as patients are doing fairly well, we'll see them every 2 to 3 months after transplant. But we keep close tabs on them.
Eric, can you hear me okay?
Yeah.
What is it like? I just asked Ellen how long she's going to be with you, and she said forever. Is that okay with you?
Yeah, it's a blessing, and with my caregiver, I was fortunate because Heather had an extensive amount of CNA and home health aide experience before I got sick. So when she did have to step into the role of being caregiver, she had a little bit of knowledge to it, but then the main thing is it's 24/7 for the last 19 months straight. You're on the clock, and so it really is an important and a really I think mentally and physically taxing position for somebody. It's very honorable. There's a lot of people, and not only are you being my caregiver, but you're still a mother to a family and trying to help function a household too. So, it's something I'll be eternally grateful for.
It's a lot. And Eric, you guys have 6 kids. And when you were traveling here for treatment with Heather, I understand your oldest son really had to step up, almost kind of take on the role of a single parent. Tell us what he meant to you during those times.
Oh man, he was such a trooper, and he went from being a 22-year-old young man, to being a surrogate father almost. Got to get kids up to school. They got to keep their grades up. They've got to keep their physical activities. One's in track that likes to do the javelin and shot put. The other one wants to be an audio video engineer, so he's trying to make home movies and still trying to keep people going to church off Wednesdays and Sundays, and laundry done. Really shocked. I'm so proud.
Yeah, sounds like a one-of-a-kind kid. Hang tight, Eric, for just a moment. We're going to get back with you in just a second. Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. Let's check in on this Friday with our COVID count. Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning.
Hi, how's it going?
Hey, good.
Yeah, so right now, again, as we heard on Open Mics with Dr. Stites on Wednesday and also on Monday, we unfortunately have an increase in our number of inpatient COVID patients. 33 active patients, unfortunately, with 7 of those in the ICU, so with severe disease. Hoping that number is a peak and not just a low part and trending up, but I think we'll have to wait to see what happens next week.
So, Hawk, this past Wednesday on Stites Show, one of our viewers, Gene, he asked about a study out of Brown that compared the risks of the two main vaccines, Pfizer and Moderna. And he asked that one study proved one shot was safer than the other, or if one shot was more effective than the other. He was curious about the difference there. And then you went back, you reviewed that study, and it sounds like the short answer is no real difference between the two shots. But what is the data showing?
Yeah, I think it was a good question, and it's really good for our viewers to do that as far as their own research. And what I mean by that is looking at the journal article. So I think that was very good and very good insight to pick that up, and a very good question. I did read this study back in August when it was published, and there are several caveats. I think this was also associated with the VA centers as well, we should mention. So there are several caveats to that. One, it is retrospective. So they're basically just only going back and looking at the data. In addition, the age groups, it really only included people, the mean age was 76. So it was an older age group as well. In addition, it was very early in the vaccination period. So December 2020 to, I believe, June or July of 21. But it was a small group of months. Also, we should note that it was only data from the first dose of vaccine. So I think with all of those things combined and looking at the raw numbers themselves, overall, the adverse events were extremely low. And so really parsing out with those low numbers, I don't think we can make conclusions, nor, again, as I said, with the population being an older population already at risk of complications in general, I don't think we can draw any causality to that. And we have many more studies since that time with multiple doses and booster doses, and all of which continue to prove the safety and efficacy of both those mRNA vaccines, but also, as Dr. Stites said, also safety and efficacy of that protein-based vaccine as well.
Hey, Hawk, what about this JN.1 variant now accounting for more than 1/5 of the cases? What can you tell us about that?
Yeah, I think it's more of it's the same old story. So anytime a new variant comes out, so far what we have seen, really with the exception of Delta, which did maybe seem to have a little bit more propensity for severe disease compared to the others. But since that time, and especially with Omicron, and this is another Omicron subvariant, by the way, really what we have seen is increased transmissibility and immune evasion. Basically what the people are meaning by that, and the authors, is the spike antibody is really a lot better and able to evade our antibodies that we have. But again, remember, we have two main arms of our immune system in that sense, and that is one is antibodies and the other is T cells. We still have very good T cell immunity to help protect against severe disease and hospitalization as well. So I think this is just more of the same right now. And looking at the CDC reports, there does not appear to be any increased risk of severe disease or any difference in the disease that SARS-CoV-2 causes. So we would still advise you to, number one, get your updated booster if you haven't, or your updated vaccine if you haven't yet this season. And number two, always have a plan. Get tested early, talk with your medical team, get on that oral antiviral if you can. All of those things are going to help reduce your risk of hospitalization and severe disease.
Hawk, thanks so much. Appreciate it. Have a great weekend.
Yeah. Bye.
All right, bye-bye. We're going to get to some community questions. Before we do that, Eric, I wanted to ask you, when you joined us last time, you mentioned something about wanting to take your boys fishing. That was one of your big goals. Have you been able to do that?
No, not yet. I've been so busy with everything else in life that that has not been able to be a function yet.
Okay. Well, just get on it, okay? Next time we see you, we want to see the photos, okay?
Yes, ma'am.
All right, question is, what do we do for patients who don't have a good support system? You know, they come to you and say, oh, I don't have anybody. What do we do? What kind of resources are out there?
As I've mentioned, we have our social workers and our psychologists that really help as well. BeTheMatch.org has a program called PACES, Patient and Caregiver Emotional Support, groups where they have one-to-one counseling as well as group-based counseling. So they offer multiple services that way. We often refer patients that are in care, that are struggling to look there. But we have a lot of meetings with them. We call them frequently. We really just dig into what their world looks like and encourage them to make the ask. So we don't stop with just, hey, I don't have somebody. We just keep going because we feel that we can pull something together for them.
Exactly, because I think a lot of people, you're right, it's not comfortable to say, oh, I've got this list of people who would just be dying to help me. They really do. They may just not realize it, right?
They do. And we keep them, excuse me.
No, please, yeah.
We'll sometimes keep them in the hospital a little longer or a little earlier, depending on the scenario too, to also help out.
To help grab together, forming that group, that troop. So how often do donors come from the National Bone Marrow Registry? Do we have versus in this case where we found a family member?
We just talked to our data manager and we'd been about 50-50 until most recently it's more of 60-40, meaning 60 more coming from related donors than the unrelated donors from the registry. So family members that are fully matched like Eric's or half matched family members. So we're just seeing a trend there. Not sure why that trend is what it is, but that's what we're seeing most recently.
I want to get our takeaways today, and Shalene, we'll start with you. Just keep us going. What do you want people to take away from this conversation?
This journey is tough, as you can see, and like Eric has done, I just encourage you to embrace the blessings along the way because you've got to have that positive outlook and take all of that with you. So,
Ellen, what's the takeaway?
Yeah, I mean, I've never had a more rewarding position in my career. I get to work with such wonderful patients and see such positive experiences with transplant. It's a tough road, like Shalene said, so glad that I get to be a small piece of that.
You think you're a small piece.
Yeah.
I think Eric would probably disagree. You're probably a very, very large piece. Eric, I'm going to let you wrap us up on this Friday. What do you want people to take away from your story, your family's story?
When I first got this diagnosis, at first I was like, oh dear, but if you do what the doctors say and you approach it in a timely manner and you throw the caregiver at it that is optimal, that cancer is not a life sentence anymore. It's not a determined death. There is hope. There is a happily ever after still.
Well, we appreciate you being that hope for us this morning and those watching who might be facing a similar diagnosis now or in the future. So we just appreciate you and your family. And my friend, we will see you again, okay?
Yes, ma'am. You have a beautiful day.
Hey, you too. Have a great holiday. Thanks to all of our guests. Thanks to our viewers for being with us today. And we'll see you back here on Monday. Coming up Monday on the Morning Medical Update. Gary Gray was too sick to keep his job. So why wasn't he sick enough to get a liver from the National Transplant List? I'm Jessica Lovell on the next Morning Medical Update. The complicated rules that force Gary to fly 1,000 miles to help save his life. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.